Hello and welcome. I'm Doug Hall. Today I'm introducing a new product to help you save lives by identifying early sepsis symptoms. Sepsis is one of the most difficult safety and quality problems facing healthcare today. It carries a very high death rate, it's very common, and hospitals have struggled with it for years. About 300 people per day die of sepsis just in the United States. Sepsis can occur at any age and in any population. Sepsis can develop within hours to a condition that requires intubation and intensive care. Patients need to be evaluated more often than the hour or so between patient visits. The new 15-second sepsis checklist can be done by anyone who enters the room. If 2 or more of the symptoms are present, the patient should be evaluated immediately. If we recognize septic patients early, we know from published data that we can make a difference. We can decrease the number of patients who develop sepsis. When you're serious about your sepsis awareness program and your surgical timeout program, you'll identify the barriers of implementation, remove them, and get these effective interventions in place. Now let's look at the benefits of the new sepsis checklist board. It's an easy way for staff and visitors to spot the early signs and symptoms of sepsis. Your rapid response team will be notified earlier. Your septic patient will likely have better outcomes by early identification and treatment of their symptoms. Your patient will likely have better outcomes of their initial reason for their hospitalization if their recovery is not complicated by sepsis. Your patient's hospitalization will be shorter, less expensive, and result in higher patient satisfaction if their hospitalization is not complicated by sepsis. You'll save lives and prevent patients from suffering through post-sepsis syndrome. The sepsis checklist board is easy to understand and easy to operate. It has a thick acrylic face and easy to see from across the room. Visitors and ancillary staff are now your partners in care to help you catch early sepsis symptoms. By implementing a sepsis checklist board program, you'll be making a huge difference to know sepsis and stop sepsis. Call me today to discuss your sepsis awareness plans and challenges, and ask about having an evaluation sepsis checklist board sent directly to your attention. Now let's take a time out and see a small sample of checklist boards that were designed by staff from hospitals across the country. Thank you for attending today's announcement of the new sepsis checklist board. Let's discuss your plans and challenges for a sepsis awareness program or to enhance your procedure timeout program at your facility. Thank you.